Hi everyone, today we're covering the examination of the trigeminal nerve. But first of all, you need to know what exactly is a trigeminal nerve. So this leaves the anterior aspect of the pons as a small motor root and a large sensory root. So where does it leave from? It leaves from the pons. So if you can recall, when we were studying neuroanatomy, I told you this is midbrain, this is pons, this is midbrain, then we have pons, and then we have the medulla oblongata. So this is the pons, right? And in pons, we're talking about the trigeminal nerve. So here, right here, you can see you have the motor nucleus and the sensory nucleus of the trigeminal. This is the motor and this is the sensory nucleus. So this thing is clear that this leaves the anterior aspect of the pons as a small motor and a large sensory root, right? Small motor and large sensory. Now, the sensory root passes through the trigeminal ganglion from which emerge the three branches or three divisions. You have maxillary, mandibular, and ophthalmic division. The maxillary division, it normally comes out of the foramen rotundum, and the mandibular division, it comes out of the foramen ovale, right? And then you have the ophthalmic division. Now, it is a mixed nerve. It has both sensory as well as motor innervations. Sensory innervations are of touch, pain, pressure, and temperature. And motor innervation is that it supplies the muscles of mastication. Now, you may be wondering what are the muscles of mastication? So, you have masseter muscle, you have temporalis, you have lateral and medial pterygoid muscles. So, these are the muscles of mastication which are supplied by the trigeminal nerve. Do not forget that, especially the mandibular division of the trigeminal nerve. Then you have tensor villi palatini, which is the soft palate muscle. The remaining soft palate muscles are supplied by vagus, but just the tensor villi palatini, if you can recall, is supplied by the trigeminal nerve. Then you have tensor tympani, which is in the ear and anterior belly of the digastric, as well as the mylohyoid muscle. These all are supplied. They get their motor innervation by the trigeminal nerve. Now, in order to test it out, first of all, we need to test the sensory part separately and the motor part separately. Before going to that, let me make you familiar with two of the clinical conditions. One is trigeminal neuralgia. Now, what happens in trigeminal neuralgia is that there is stabbing pain over the area of the face, which is, and this is most commonly felt over the skin that is particularly innervated by maxillary as well as the mandibular division. So it's basically stabbing pain over the area of the skin, which is innervated by maxillary as well as mandibular division. And what about herpes zoster ophthalmicus? Now, herpes zoster ophthalmicus, this is basically rash kind of disease which occurs because of the varicella zoster virus. So this virus causes shingles and it causes painful blistering rash around the area of the eye and around the area of the, you can say, a forehead. So basically there is periorbital vesicular rash, and this occurs because of the lesion in the ophthalmic division of the trigeminal nerve, and lesions in the maxillary and mandibular division of the trigeminal nerve will lead to trigeminal neuralgia, which is stabbing pain, and lesion in, or because of the reactivation of the varicella zoster virus. The varicella zoster virus is going to basically affect the ophthalmic division of the trigeminal nerve, and it will cause periorbital vesicular rash. If you want to see its image, do we have an image here? Okay, I didn't save it here, but yeah. Anyways, moving backwards, we have to test the sensory as well as the motor part. So for the sensory part, you need to do the corneal reflex. In corneal reflex, first of all, you need to follow the entire procedure where you um, greet the patient, you introduce yourself, you explain the procedure, you reassure them that they'll not experience any pain, and then you take the consent. Then you approach them from the right hand side. So these are multiple things. Then after that, for the corneal reflex, you have to take a cotton wisp and you have to touch gently the lateral edge of the cornea at its junction with the conjunctiva. And what will be the result? That the patient will, or the subject is going to blink his eyes. And the two eyes, both of the eyelids, are going to blink simultaneously. Because this reflex is symmetrical to the both eyes. Now, afferent component of this reflex is through the fifth nerve, whereas the efferent is through the seventh nerve, which is your facial nerve. Now moving forward, if you talk about the conjunctival reflex, for the conjunctival reflex, you have to do the entire same thing, and you have to touch gently with the help of the cotton wisp, the lateral edge of the conjunctiva. And again, the reflex would be that the patient is going to blink the eyes and it will be symmetrical on both the eyes, and afferent by fifth nerve and efferent by the seventh nerve. If there's lesions of the ophthalmic division, the cornea and conjunctiva, they're going to become insensitive to the touch, and there'll be no blinking. The reflex will be absent if there is lesion of the ophthalmic division. And for the sensations, what you need to do is ask the patient to close their eyes, and then you have to, if for example this is the face, so you have to use the cotton wisp to first touch here and here simultaneously, not simultaneously, I mean you'll touch here and then here as well, because you have to test both the areas. So this is a precaution that you have to compare the two sides every time, right? So yeah, you'll touch here and then here, and then you'll touch here and here, and then you'll touch here and here, and after every touch you have to ask the patient, do you feel something, and they'll tell you yes or not. If they feel something, that's well and good, because they can feel the touch sensation. So for touch sensation, you're using the cotton wisp. So what are the sensations that we're checking? Ideally, there are four sensations that are present: touch, pressure, touch, pain, pressure, and temperature. So for touch, we have used the cotton wisp. For pain, you have to, or even for pressure, so for both of them, you have to use a sterilized pen, and you are going to again do the same thing and compare both the sides: 1, 2, 3, 1, 2, 1, 2, 1, 2, 1, 2, right? And what will happen is they'll tell you if they feel something sharp or not. But be very careful doing this, please, because um, ensure that you do not prick the patient. It should be very gentle. Then moving forward, we have to talk about the temperature. For that, you need to fill two test tubes. One will have warm water or hot, and one will be cold. And then you can touch it around the give them the temperature sensation and ask them if they feel hot or cold, right? Now, for the motor part, you need to first of all check, because I told you its major supply is to the muscles of mastication, motor supply. So for masseter and temporalis, you have to ask the patient to clench their teeth. For pterygoids, ask them to open the mouth, and then you have to do the jaw jerk or the masseter reflex. So clenching the teeth, and then you'll touch the sides and you'll feel the masseter and temporalis. And and then after that, what you have to do, basically you're going to palpate and check. And after that, ask patient to open the mouth. For this, we're checking the medial lateral pterygoids. If the patient is unable to open the mouth, or if it is deviating towards, if there's some lesion, the jaw is going to deviate towards the paralyzed side, because the healthy pterygoids, they're going to push the muscles to the opposite side. So this is basically what happens when there's lesion of the trigeminal nerve. And other than that, you have to, if you want to check the weakness, what you can also do, you can ask the patient to move the angle of the mouth from side to side. So move the angle of the mouth from side to side, and by that you can check the weakness of these muscles. For jaw jerk and masseter reflex, what you have to do is basically ask the patient to open their mouth slightly first of all, and after that you can do the jaw jerk. So once the mouth is open, I can show you a picture for that right here. You can see once the mouth is open like this, then you have to uh, keep your finger right there, and then using this hammer you have to gently tap, and there'll be a jerk. If there's a jerk, it means that everything is perfectly fine. But sometimes the jerk is absent even in the healthy individuals, because they get overly conscious. And other than that, sometimes it's very increased in the upper motor neuron lesion, that there'll be excessive jerks. That will be upper motor neuron lesion. And if you want to see the muscles of mastication, these are the muscles of mastication. You can see lateral and medial pterygoids. The largest one, that's masseter, and this is temporalis. So this is masseter. This is the up, the one at the up, that's temporalis, and the lower one, that's masseter. So I hope you've seen these. This is temporalis. Okay, so yeah, that's pretty much it. We've covered the trigeminal nerve.